When you suffer an injury, no matter what age you are, you want the best treatment. And Orthopaedic Medical Group of Tampa Bay says after serving the Bay Area for more than 45 years, they are the place to go to get the highest level of care with 9 locations throughout the Bay Area. They treat everything from hip and knee replacement to ankle and tennis elbow injuries. So today in our Fitness Friday, sponsored by OMGTB, we have Dr. Daniel Tarazona here with more on how to prevent those injuries, whether you're young or old. So welcome, how you doing?
Good, I'm doing great. Thank you for having me.
I'm thrilled that you are here. So, okay, to start, can you tell us a little bit more about what you do?
Yeah, so I'm an orthopedic surgeon. It specializes in sports medicine. I treat all active individuals and athletes of all ages, of course. I try to emphasize on non-operative treatment, which includes physical therapy, medications, supplementations, nutrition, injections, biologics, such as PRP, and then if necessary, I do minimally invasive arthroscopic surgery, all the way up to robotically-assisted surgeries as well.
Okay, fascinating. So what are you seeing a lot of right now when it comes to injuries?
Yeah, so one of the big things, obviously, we all know pickleball has been on the rise.
Oh, yes.
So been seeing a lot of injuries related to that. So ankle sprains, Achilles, calf injuries, rotator cuff injuries, and then tennis elbow, of course.
Really? Okay, that's fascinating. Yeah, we have a lot of pickleball players here in our community for sure, especially with the beautiful weather. And speaking of the weather, you know, with it getting warmer here in Florida, a lot of people are going to be outside more. And so do you anticipate an increase with the types of injuries that you've been seeing and others?
Yes, definitely. So as the weather gets a little bit warmer, obviously people are going to be a lot more active. Sure. In general, we try to kind of teach people on what they can do to prevent some of these injuries. So in general, I try to tell them, hey, look, you want to have a good warm-up routine, a strengthening program as well, and then kind of focus on some of the cool down mechanisms or to kind of prevent some of that stiffness that sets in, you know, later that day or the next day.
Okay, good to know. So you mentioned those warm-up exercises, and yeah, people tend to skip those. And you have some exercises, right, that you would like to show us, and these are things that people can incorporate into their normal fitness routines?
Yes. Okay. Yeah. So do you mind if I go ahead and show you?
Yes, let's do it. What do you have for us first? Walk us through everything.
Alrighty. So first we'll kind of focus on some kind of lower body or lower exercises. The first thing is ankle and Achilles. So the first thing is just if you can kind of find a simple step at home, stairs, platform, anything that you have. I want you to kind of do a quick upward movement. So you're doing like a calf raise.
Like a releve that you say in ballet.
Yes. And then on the way back down, do something very slowly. You can have a modification of doing it single leg as well.
Okay.
If you ever kind of watch how some of these injuries occur, generally it's when the athlete is kind of pushing off and really stretching that muscle.
Right.
So by doing this, we're kind of mimicking that and kind of getting the muscle ready and tuned, firing it on all cylinders.
Okay.
The next thing is kind of a good general lower body exercise, which is a modified lunge, where we're essentially, you're going to kind of lift your leg, hold a pause for 2 to 3 seconds. That's going to work on balance, core stability. And then you're going to go into a lunge and then kind of come back out. And I'm going to set a little aside. The next movement is going to be kind of out. You're going to go out to the angle. You're going to go out to the side. And then the last movement is going to be going back.
Okay.
With a lot of these sports, you're obviously going to be moving in multiple directions. So you want to make sure that you're warming up everything. I prefer more dynamic exercises than kind of like the static ones that we think of just holding that pose for 30 seconds.
Like leaning or like doing that.
Yeah, you kind of want to get ready for what you're about to do.
Okay.
As far as shoulder and elbow.
You brought some resistance bands.
Yeah, this is simple. You can get this really at any sports store. But so for shoulder injuries, there's basically 4 rotator cuff tendons. So I'm going to give you 3 simple exercises to kind of work on all of those.
Okay.
The first one's going to be just kind of a straight raise out in front.
Gotcha, yeah.
Up, down.
Okay.
Then the next one is you can kind of just loop it through the fence or around a pole, but basically you're going to be kind of doing a motion where you're kind of going out.
Okay.
And going out.
And that's working that rotator?
Rotator cuff going out. The other one's rotator going up. And then the last one is using the same band. You want to kind of go in. So those 3 exercises really should get your rotator cuff kind of firing.
Okay.
And then the last thing, of course, we can't leave out tennis elbow injuries.
I know. Yeah.
So you're kind of just, you can kind of sit back down here, but you can kind of, be like stepping on the ground here.
Ah, I see.
So tennis elbow basically involves an injury to the muscles that attach to the outside of the elbow. So a lot of people are going to complain of elbow pain. So doing kind of this exercise where you're going up, kind of hold it, and back down, up.
And you
hold
want to
it
do
down.
this seated, in a seated position.
Yeah, so you can really just kind of focus on. You can do it standing. It's just going to stretch the bands out more.
Gotcha.
And then to kind of golfer's elbow, which is another injury that typically happens more on the inside. You obviously just flip your forearms forward.
Okay.
And then kind of going in this direction.
Okay.
So, I mean, I think if you can kind of incorporate these simple exercises, it should take you no more than 10 minutes. And at that point, that should really kind of help you get ready to go.
Okay, I love this. All these great preventative ideas and tips, and then you can help us if something happens and goes wrong.
Yeah.
Well, Doctor, we appreciate you joining us.
Thank you for having me.
joining
I
us
appreciate
today.
it.
That was great.
Alrighty.
So to learn more about everything they do and their locations, you can head to the website on your screen. Really easy to remember, omgtb.com.